right, I'm just gonna start by taking a look at my patient information to see what I am doing my wound care on. It looks like my patient has a post-operative abdominal wound following a laparoscopic cholecystectomy or gallbladder removal. So it looks like I am gonna go in. My patient does have mild pain, which we administered some meds about 30 minutes ago, and now I'm back to address that wound. I guess it's just a normal wound change. It looks like everything just cleaning and reapplying. So let's get started. All right, I am going to do some hand hygiene. All right, hi, my name is Sophie. I am going to be your student nurse today. I am going to be doing wound care changing that dressing on your abdominal wound. Can you tell me your name and date of birth? Wonderful, that matches perfectly and everything looks great. I'm gonna close the curtain, or in this case, a door where I'm in a private room. And I'm now going to prep and gather my supplies. So I've got my care kit. I'm just gonna put that next to there. My hand hygiene, everything is ready to go. And I'm gonna get some gloves on. Perfect. I am gonna sneak back here really fast and grab a waste receptacle bin so that I can have something to put my garbage in. All right, let's get this on. I am going to lower my patient so that they are somewhat in a comfortable position. They said right there is good. And I'm gonna raise them up to a comfortable height for me. Do we come around here maybe?
Yes.
And then, all right, that's about comfortable. Are you doing okay? I'm gonna check under the patient and make sure that there is a Chuck's pad or like a moisture pad that collects my moisture or any drainage that comes out. And there's a bath blanket on my patient so that nothing is showing that doesn't need to be. I am going to take this down and just reveal that wound. Nothing else. Keep my patient privacy. All right, let's make sure I have everything. I'm gonna assess for any tubes, drains, or anything that'd be in the way, and I'm not seeing any that I should need to take care of or move out of the way so that my patient is safe and taken care of. So next I'm going to remove the dressing that is on, and I'm gonna do like the pull method and follow with the hairline. So I'm just gonna pull this up a little bit. Does look like we do have some tape. And it wants to come off this side, so I'm just gonna follow that and make sure I stay sterile. All right, looking at my wound, I'm gonna look for any fluid, and on my bandage it is clear, but I would normally check for serous sanguinous, or sanguinous fluid. Also any purulent fluid. At this time there's nothing, but I would want to document that. That's gonna go in the garbage. I'm going to also assess the size, if there was any odor, the type, all of those things. I am now going to remove these gloves and do some hand hygiene. And before I would have removed those gloves, I would have taken this packing out. That's my fault. Okay, now I'm gonna assess the wound for the appearance, what it looks like. It looks like there's a little bit of red around the outside. It is deeper. So I'm gonna take this sterile stick and I'm going to measure. So if I measure along the thing, it's about 14 by about 4, and depth we're looking at about 3. That's in centimeters. That's gonna go in the garbage, and I'm gonna make sure that I document that. Appearance looks great. Like I said, everything looks good. I'm now gonna prepare my sterile field, so I'm gonna move this out of the way, and I'm gonna start by getting my gloves on. Fold my flaps down. Oh, that one doesn't want to stay in. I don't want to break field. All right, I'm going to tuck up under and make sure that these stay. Okay, I'm going to put my right hand on first, so I'm going to pinch this part here and slide my hand in, make sure that I'm not breaking sterile field. And now I'm going to tuck up under and slide my next hand in, making sure I'm also not breaking sterile field. And then I'm going to make sure to correct those so they look good. and swipe that out of my way so that I am not touching anything. Next, I'm gonna open this. So I'm actually gonna turn it around and peel this back. Okay, I totally messed that up. Taking these off, that's my bad. I'm gonna put the ones on in here because that's sterile. So pinch these, and let's open this and do this right this time. I don't know why I put this on before. All right, doing this correctly. Let's move this by the bottom out of the way. And let's do this accurately this time. All right, here we go. Put these on carefully without touching. Make sure to keep it up. I'm gonna come down here. Okay, perfect. I have to do it again. My glove ripped. This is so bad. Let's take these off. I don't know why I'm a struggle today. Peel this away and try one more time. All right, let's do this the right time last time. Don't know why I'm a struggle. Okay, let's open this correctly. And put my gloves on accurately this time. Okay, now tuck under, and without ripping, I'm gonna slide my hand in there and get my glove on. Sterile this time. Move that out of my way. All right, here we go. I'm gonna pinch this. I'm gonna lift it straight up and out away from the table. Grab this and set it down gently without touching my sterile thing. I'm gonna scoot this over. Next, we have this red bag. I'm gonna open this up, keeping my hands above my waist. I'm gonna kind of roll it open and sit it here on the bed. Okay, put this here, set out all my stuff. Okay, keeping my hands above my thing. That was a little high, I apologize. Keep this here. And then now I'm gonna hold this and pull out my fluid. Okay, I'm going to prep my fluid in my container, if I can get it open. Okay. All right, let's dump this in. Okay. Keeping clean. All right, let's clean my patient's wound. So I'm gonna grab some sterile gauze. I'm going to wrap it around my finger. I'm going to dip it. And I'm gonna start by cleaning down the middle. Just nice and gently, and in the bag we go. I'm gonna get another one, wrap it around my finger. I'm going to dip it gently, and I'm gonna wipe it down the side, making sure that my hand is not touching the actual patient. And in there, I'm gonna get one more and prep it around my finger. I'm gonna dip that, make sure that it's nice, and clean down this side of my patient and in the garbage. All right, let's dry my patient off. So we'll get another sterile gauze, and we're gonna dry down the patient, just dabbing so that we don't cause any friction or shearing. Okay, one more. And just making sure I don't touch it, just dabbing down that patient. Perfect. Okay. To pack my wound, I'm gonna grab some of this extra gauze that I have. Actually, I'm gonna use my roller, and I'm gonna grab just a little bit of it so that it's nice for my patient. And we're gonna cut that. Make sure that we don't do anything unsterile. We're gonna tuck that and we're gonna pack the wound. My hands do not have anything gross on them. If they did, I would change my gloves at this point, but since they are not contaminated, I'm gonna continue to now dress my wound. I am gonna get the sterile pad to put over, and we're gonna place that on top of the wound. And now I'm gonna take my gloves off. I am going to do some hand hygiene. And now I'm gonna prep to tape my wound so that it is all clean and secure to my patient. Okay, we'll tape on the sides. With my patient's situation, I'm not gonna put tape on the top and the bottom, but in normal scenarios, I would for a patient. But I will tape down that other side just to make sure that it is nice and secure. Okay, that will go in there. I am going to place this. I'm gonna write on here the patient's name and their date of birth and the dressing change, all of that, and sign it. And then I'm going to stick it on to my patient, not touching anything else. And then I can now clean up my sterile field. That will go in my red thing. And from the outside, so I'm not getting anything contaminated, I'm gonna tuck that into itself, and that's gonna go in the garbage with the tin. Okay, I'm now gonna do some hand hygiene again just because I want us to keep clean. How are you feeling now that we've changed everything? I'm gonna go back really quick. When I did change that, I would have put on any gels, barriers, anything like that, but my order did not request it. So let's lower the patient back down to the lowest level to keep them safe. All right, and then let's cover you up back so you feel nice and comfortable. Are you feeling okay? You want your head up a little bit? All right, is there anything else I can do for you today? Okay, have a great day.